Welcome to the Chiropractic and Legal Injury Podcast, recorded live at our events. We're here bringing you the expertise, insights, and tools you need to navigate the world of personal injury care and to uncover what you didn't know about car accidents. It's no accident you're listening today, so let's get started.
Hi, good morning, and welcome to the Chiropractic Legal and Injury Podcast. We are joined today with the legendary orthopedic surgeon, Dr. Brian Gruber. Dr. Gruber, thank you so much for joining us today, and really appreciate you being willing to participate today in presenting on the topics of knee and shoulder surgeries. So tell us a little bit about you and what it is you do.
Thank you, Larry. It's great to be here. What an event. Turnout's incredible. So yeah, I'm an orthopedic surgeon. I've been in town since 2007. I do a lot of shoulder, a lot of knee. We really kind of branched out. You know, we've worked together for the better part of 15 years, which has been great. We just opened up a surgery center 3 years ago, which has been really wonderful to be able to take care of our patients in that capacity.
That's amazing. So we've done a lot of personal injury cases together. We've worked with a lot of chiropractors out there. And can you tell us a little bit about the importance of the collaborative work that you do with chiropractors, specifically on knee and shoulder injuries?
Yeah, really, it comes down to teamwork and communication and making sure that not only the patient is well taken care of and whatever musculoskeletal complaint they have is satisfied, but also being able to get them kind of through this system. Many times this is the first time they've ever had this type of event happen to them, a personal injury. And the system can be unfriendly at times, and we do our best not only from a medical standpoint, but just to understand, how to navigate some of these, challenges. And I think that's where you do a great job because you're not only are you clearly well liked by your patients, but you take very good care of them and make sure that you kind of have that true kind of quarterback mentality to associate with the right people at the right time and kind of matriculate the ball forward, if you will.
Sure. So. I've always said that there are three factors that make a physician effective. Number one is excellent bedside manner. Number two is being good at what they do, whether in your case, surgery. And number three, documentation. All three, in my opinion, is what makes an excellent surgeon or an excellent physician to work with in the personal injury arena. Now, you're also an independent medical examiner, right?
Correct.
All right, tell us a little bit about your experience doing that.
Yeah, you wear a little bit of a different hat. You're a little bit more of a sleuth. There's a little bit kind of an investigative component to that as well, which is always a little bit interesting. Clearly you go back to your medical roots as far as what's going on from a pathology standpoint. But it's needed. Patients kind of get in a situation where they need extra support. With an independent exam. So for us, it would be the claimant at that point. But they're it's a totally different area. So I think it's something that a lot of people. I think would be hard to dabble in that.
Sure.
Because you kind of either have both feet in it, or you kind of would probably stay away from it.
Right. Well, one of the things I love about working with your office is not only do you have excellent bedside manner, you're an excellent surgeon, and you have great documentation, you've got experience. You've been doing this for a long time. You've been involved in lawsuits. You've testified. You've had your depositions taken. So when you're on a case, you bring all of that credibility, that experience, and it's been an absolute pleasure working with you and your team. So we're here at a chiropractic conference, and chiropractors are very conservative with their treatment, their modalities, but not every shoulder or knee injury can be treated by chiropractic care, like tears or
Sure.
needs for new shoulders, new knees. So can you tell us a little bit about some cases that you've worked on, personal injury cases with chiropractors where you got involved and you had to do some really hardcore invasive surgery?
Yeah, I think the chiropractors do a really good job because I think most of it doesn't end up in ortho because patients go in to their chiropractor, and in the Phoenix market, I would say that the vast majority of patients when they are injured, most of them seem to start with chiro. And a lot of those patients end with chiro because they have a contusion, a bruise, a sprain, strain, and they're able to get them better in a fairly short period of time.
Sure.
We kind of jump in, from a referral standpoint, when that case gets a little bit more interesting, if you will, longer duration, or just more traumatic, and I think that's the important thing with the folks that we work with. Do a nice job of being able to transition the patients over quickly versus, 6-8 months later, and then the case kind of has gotten a little bit long, maybe a little bit stale, but the patient's still having problems.
Sure.
So you have to kind of jump start it. So I think the folks that we've been working with have done a nice job of being able to quickly, appropriately transition care, in a timely fashion.
Yeah, that's great. And that is a huge attribution to the success of the cases. And I think it's so important that we have somebody like you to be able to collaborate with, work hand in hand with the chiropractors to really treat those advanced injuries that either require surgical intervention or PRP injections and stuff like that. So, and you do all of that at your clinic, right?
Sure. And it's important, I think, when the chiropractor, they still, they have relationships with these folks, and a lot of them are long-term patients of theirs. In orthopedics, oftentimes we're kind of, call it one-hit wonders, where you have a period of time with somebody and then they're gone, and that's kind of the nature of the beast with the surgical subspecialty, which is usually a good thing, that you're able to kind of take care of their problem and they're satisfied and happy and they're done, and maybe they come back for another problem or they send their friend. But we have these sort of points of care, if you will, with the chiros. I think it's important, for example, if I see somebody for their shoulder and their neck, I'm going to make sure that, we get their shoulder taken care of. And of course they can go back and continue to seek their chiropractic care for their neck. I think that's important, where, I think some of the, some folks at some point might worry that, that the patient that was kind of theirs is no longer theirs. And that's not our philosophy. We like to make sure that, the chiros are still involved with the care, until the end.
Sure, that's great. Earlier today, we were joined by Dr. Alicia Vardavan, the neuroradiologist. We also had Dr. Mohammed Abdul Hamid, the neurosurgeon, and they both brought up the importance of communication with the chiropractors and collaborating on cases. So if a chiropractor is thinking about referring to an orthopedic surgeon and they're looking to refer you the case, what type of communication and collaboration may they expect when working with you in your office?
Yeah, I mean, I would say that, more or high touch than not, as far as, being able to, get in to see us. We're always working, Larry. I think you know that. Larry's conference actually took me out of my Saturday clinic, which is a good thing today. But I mean, we have point person Desiree. She's our point person right now. So it's really easy to get into us, and we do the appropriate vetting, of course, and we get things going.
Absolutely. Well, is there anything else that you would like the chiropractic community to know about you and your clinic?
Yeah, I mean, we treat, it's just not surgical. We really do all orthopedics. I think that's important because a lot of people today, for example, they'll see us talk about shoulder and knee, or hear us talk about shoulder and knee, but we do elbows and ankles, and there's just a lot of that. And I think and people come to an orthopedic surgeon office, and it's not all surgery. I mean, realistically, it's maybe 20% of the patients we see even need an operation.
Sure.
So most of it is, and then we have we have all the other facets of needed care, physical therapy, and I mentioned the surgery center. So I really like the fact that when we get patients, with us, that we're really able to, treat all facets of the needed care. And, I think that makes them feel good in our system, where it's, because medicine is very fragmented, and, you're going here for your MRI, you're going here for an x-ray, you're getting your orthopedics here, maybe you're going here for an injection, here for surgery. So it can get kind of, daunting a little bit, as far as, all the areas. So we're able to really kind of keep folks in-house, and, they kind of see the same faces, talk to the same people, they get that level of comfort, which I think is important.
A couple of years ago, we had a case together, and you did a shoulder replacement surgery on a 74-year-old client of mine. And when you were done, that person had full range of motion back in their shoulder and back on the golf course within months. And that was an absolutely amazing recovery and excellent job that you did. What made you become a surgeon?
Well, I was going to be a pro baseball player, and that didn't work out.
I was going to be a model, but it turns out I'm not very good looking. So went to law school.
Yeah. I was fortunate. I knew as a kid that when I hurt my elbow, and
Sure.
kind of a very classic orthopedic story. But yeah, I went to a orthopedist in my town, and I thought that at 10 years old that would be a pretty cool job, and I think I really thought more about taking care of baseball players and
Sure.
not. And then that just stayed with me, and I look back on that and I was really fortunate because I know a lot of folks struggle a little bit about what they're meant to do and their vision, and I see it in the office when I talk to the young kids and young people, and I feel like knowing that, looking back at where I was really fortunate to kind of stumble on that, and it's truly a passion. It's really what I love to do, and it's my life, and
Sure.
I put it all out there, and everything goes into it.
That's amazing. And we all know professional athletes, they want the best care possible because they want to get back out on the field, back out on the diamond. And have you treated a lot of professional athletes in your career?
Yeah, we do all levels. I think at the end of the day, you're taking care of a lot of the weekend warriors. You're taking care of a lot of the high school kids, the college kids. But right now, these pickleballers, I mean, it's insane. The amount of pickleball injuries that we're all seeing is really taken off over the last 5 or 6 years.
Do they have a new name for it? Like you had tennis elbow. Is there like a
Not-
pickleball elbow?
Not yet, but it's really, it's an equal opportunist from an orthopedic standpoint. It's just not shoulders and elbows.
Sure.
It's knees and hips and sprains, strains. I think a lot of it really is, for our pickleballers out there, I think it's important, to make sure. I read an article. It was an interesting concept where it was sort of like you don't play a sport to kind of get in shape for the sport. So a lot of folks, may not have been and we see that out here where patients may not have been very active for the last maybe 5 or 6 years for different reasons, and then they come out and then they start going, full force.
Sure.
And that's when some of these injuries happen.
Yeah, I'm one of those. I'm the worst. Yeah, I was a Division I athlete 30 pounds ago, and every time I get back into a weight room or on a basketball court or get back into a swimming pool, I pretty much hurt myself almost every single time because in my head I'm still a Division I athlete, and
That's right.
in actuality I'm a middle-aged lawyer who sits on his butt all day, and it just doesn't go well, doesn't end well. And that's why I'm actually a patient of yours, and you stick a needle in my knee the size of my middle finger.
Right.
But I trust you to do that, and you're absolutely amazing at what you do, and we're very lucky to have you on the panel today. Thank you so much for taking time away
Larry.
from your clinic to participate in that.
Of course.
What are you looking forward to the most about today's panel?
Well, I think just collaborating with the turnout's amazing. I mean, it's wonderful, and I think getting kind of seeing old friends and meeting new ones.
Sure.
And I think that's important. And at the end of the day, it's the medical community, and we have a mission of taking care of people. And the more people and it's better. It's better for patients, and to have that collaboration with a good very good network.
That's great. Well, on behalf of my office, my clients, you do an amazing job. It's such a privilege to work with you.
I feel the same about you guys.
Thank you so much, and thank you for joining us today.
Thanks, Larry.
We look forward to seeing you on the panel.
Very good.
Thank you.
Okay.
From all of us at the Lazzara Law Firm and the Chiropractic and Legal Injury Conference, thank you for listening. We hope you never need us, but if you or someone you love does, know they'll have a team dedicated to helping them rebuild, recover, and reconnect with what matters most, their loved ones and the life they deserve. This is the Chiropractic and Legal Injury Podcast, where knowledge is power and collaboration transforms care. If today's episode opened your eyes, share this episode with your network and help spread the word about the realities of personal injury care. Follow us on social media to keep learning and connecting with this incredible community.